Namaste Vidya. Hamisha Khush raho Vidya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series, we are discussing about the diseases of the urogenital system. In today's session, we are going to discuss about nephrolithiasis. Till now, we have discussed various diseases of the urogenital system, which includes UTI. We have discussed about acute renal failure. We have discussed about chronic renal failure. We have also discussed about the nephrotic syndrome. In today's lecture, we are going to discuss about a very important disease for which the homeopathy is very well known, that is nephrolithiasis or kidney stone. Homeopathy offers very good treatment for such cases, and it is believed that a lot of patients are getting cured without even the help of surgery, just by means of medicines only. So let's start understanding nephrolithiasis. What is nephrolithiasis? What are the different causes of nephrolithiasis? What are the different types of stones in the kidneys? What are the various sites at which the stones can be lodged? How to investigate them? What are the various clinical features? How to investigate them and how to manage such cases? So let's start with the nephrolithiasis. So in the presentation, I have shown you a picture that is showing different type of stones and the different sites at which the stone is lodged. So the stone can be lodged in the kidney, it can be lodged in the ureter, and it can be lodged in the bladder. Nephrolithiasis is basically the formation of stone formation. It refers to the formation of the stones in the kidneys and the urinary tract, including bladder and ureter. So in the nephrolithiasis, there will be formation of the stones in the kidneys and the urinary tract. That includes the ureter and the bladder. These are urinary salts. The nephrolithiasis basically are the urinary salts that are bound together by colloid matrix. So these are bound together by the colloid matrix of the organic material. So what is nephrolithiasis? It is basically the urinary salt, and these are bound together by the colloid matrix of organic materials. It consists of nucleus that is having concentric layers of the urinary salts that are deposited. So nephrolithiasis, it refers to the formation of the stones in the kidneys and urinary tract, including the urinary bladder and the ureter. The urinary salts are bound together by the colloid of matrix of the organic materials, and it consists of a nucleus around which the concentric layers of the urinary salts are deposited. According to the location, the stone can be, if it is located in the kidney, it is known as nephrolithiasis. If it is present in the ureter, it is known as uretrolithiasis, and if it is present in the bladder, it is known as cystolithiasis. So if present in kidney, it is known as nephrolithiasis. If it is present in the ureter, it is known as uretrolithiasis, and if it is present in the bladder, it is known as cystolithiasis. Now, what is the incidence and etiology of the kidney stone? So the renal calculi, these are very common, and it is affecting around 1% of the population, and it is recurrent in more than half of the patients. So renal calculi, this is basically, it is very common and it is affecting around 1% of the population. It is recurrent in more than half of the patients. So if a person is affected by the renal calculi, it is getting affected again and again by the same. This stone formation begins due to the supersaturated urine. So whenever a patient is coming to us with the stone formation tendency, so we must know that there is supersaturation of the urine with insoluble components due to, so there are supersaturation of the urine and insoluble components that are due to low urinary volume. We have excessive or insufficient excretion of the selected compounds and other factors, which includes the urinary pH that diminish solubility. So we have low urinary volume, but there is excessive or insufficient excretion of the selected compounds and the other features that includes the diminished solubility. Now, there are two types of stones that are usually found in the patients. One is the primary stone and the second is the secondary stone. What is the difference between the primary and secondary? So one, we have primary stone and the other one is the secondary stone. So the primary stones are appearing without any antecedent inflammation. So whenever a patient is coming to us without any antecedent inflammation that is leading to the formation of stone, it is known as primary stone. So primary stones appears without an antecedent inflammation in the urinary tract, and it occurs in the acidic urine. The secondary stones are formed as a result of inflammation. So as a result of inflammation, the stones that are formed are known as secondary stones, and it occurs in the alkaline urine. So primary stones were seen in the acidic urine and there was no inflammation preceding to it. And secondary stones are as a result of inflammation, it occurs in the alkaline urine. Now, what are the different types of primary stones? So primary stones, first variety of primary stone that we should know is the calcium oxalate stone. Calcium oxalate stone, it is basically a shape of a mulberry. It is a mulberry stone and it is usually seen in single, dark, spiky form with spikes, and it is very hard to break. So calcium stone is basically a mulberry stone. It is single, dark, spiky, and is very hard. Second variety of the primary stone, we have uric acid stones. These are rare stones basically, and these are radiolucent. So you cannot see these stones in the X-rays. These are multiple faceted and yellow to dark brown in color. Third is the variety is the cystine stone. Cystine stones are seen in the young girls at puberty. These are multiple soft yellow or pink stones. So calcium oxalate stones basically can be due to mulberry stones, and these are single, dark, spiky, very hard. Next, we had uric acid stones. These are rare and radiolucent, multiple faceted, yellow to dark brown in color. The third variety is the cystine stone that is seen in the young girls of puberty. These are multiple, soft, and yellow to pink in color. The fourth variety is the xanthine stone. Xanthine stones, these are extremely rare stones, and these are smooth, round, and brick red in appearance. And the fifth variety is the indigo stone, and these are blue stones which are very uncommon. So primary stone, we have discussed about 5 different types of primary stones: calcium oxalate stone, uric acid stone, cystine stone, xanthine stone, and indigo stone. Indigo is of blue color and very uncommon. Now we come to the secondary stones. Secondary stones are maybe because of the calcium phosphate, the majority of the secondary stone. We must remember that secondary stones were formed as a result of previous inflammation, and these were seen in alkaline urine. So secondary stone is due to calcium phosphate, majority of the stones. And we have triple phosphate, that is calcium, ammonium, magnesium phosphate. And it is smooth, soft, and friable with dirty white in color. It is mixed with phosphate stone as covering of the primary stone. So secondary stone are due to calcium phosphate deficiency. It is seen in majority of the cases. There are triple phosphate, which includes calcium, ammonium, magnesium phosphate with smooth, soft, friable, and dirty white appearance. There are mixed stones that are phosphate stone as a covering of the primary stone. Approximately 75% of are the calcium-based or calcium oxalate stones, calcium phosphate or other mixed stones. So most common variety is basically the calcium-based or calcium oxalate stones that you are going to see in your practice. 15% are the struvite stones that consist of magnesium ammonium phosphate. 5% are this uric acid stone and 1% are the cystine stones. So 15% we have struvite stones, 5% uric acid, 1% cystine, and these are reflecting the metabolic disturbances from which they arise. Now, what are the clinical features? Clinical features are the signs and symptoms with which the patient is coming to us with the complaint of nephrolithiasis. So first of all, we are going to discuss about the symptoms and then the signs. So in the symptoms of nephrolithiasis, it can be asymptomatic or may cause hematuria alone. So the patient can be asymptomatic or the patient may be present with hematuria alone. With the passage, there is obstruction. They may occur at any site along the collecting system. So with the passage of stone, there may be obstruction that can occur at any particular site of the collecting system. There may be severe pain that is often radiating to the groin. So loin to groin, this is usually seen in the pain. Other symptoms include nausea, vomiting, diaphoresis, and lightheadedness. So the patient can also, other than pain, the patient can complain of nausea, vomiting, lightheadedness, and diaphoresis. Here are the features of hematuria, pyuria, and urinary tract infections. So we will have the features of hematuria, there will be pyuria and urinary tract infections, and hydronephrosis. There will be staghorn calculi that may be completely asymptomatic, and it is presenting with the loss of renal function. So there can be a staghorn calculi, and this will present with absolute loss of function. Pain in the ureteric colic, there will be crampy, sharp, often excruciating pain that is fluctuating in intensity but not completely relevant. There can be the features of hematuria, pyuria, and UTI, and hydronephrosis. Staghorn calculus is usually associated with recurrent UTI and urea splitting organism. The pain is associated with nausea, vomiting, and sweating. The pain extends from loin down to the line of ureter to the groin, and there will be loin pain and hematuria without colic. So these are the various symptoms that we are going to see in the patient with nephrolithiasis. It can be asymptomatic or hematuria alone. With the passage of obstruction, there can be obstruction at different sites. There can be severe pain, often radiating to the groin. There can be nausea, vomiting, diaphoresis, and lightheadedness. There can be hematuria, pyuria, urinary tract infection, and hydronephrosis. Staghorn calculus may be completely asymptomatic and presenting with loss of renal functions. It is associated with recurrent UTI with urea splitting organism. There will be pain of the ureteric colic, crampy, sharp, often excruciating pain that is fluctuating in intensity but not completely remitting. There will be pain that is associated with vomiting and sweating. Pain extends from the loin down to the line of the ureter to the groin, and there will be loin pain, hematuria with or without colic. Now we come to the signs of the nephrolithiasis. There will be tenderness that is present at the renal angle, that is known as Murphy kidney punch test is done. There will be muscle rigidity over the kidney and swelling in the flanks. The patient will complain of the abdominal distension and diminished peristalsis. So there will be tenderness that is present at the renal angle posteriorly, muscle rigidity over the kidneys. There will be swelling in the flanks and abdominal distension and diminished peristalsis. What are the various investigations that could be done in this particular case? So in this case, a patient can go for blood examination, in which we can do routine examination. We can check for blood urea, NPN, creatinine for the renal function. Serum calcium level can be checked for, and serum uric acid level can be checked for. In the urine analysis, we have to check for the physical examination. The urine may be smoky or opalescent. There are different chemicals for the checking of pH, protein, and blood. In the microscopy, we have to check for the RBC, pus cells, cast, and crystals. We can also check for the bacteriological examination, that is highly important, which includes culture and sensitivity. Renal function has to be done. We can also go for chest X-ray, KUV region, ultrasonography. Intravenous pyelography is a very important investigation. Computerized tomography, renal scan, and examination of the stone. So in the examination, we can go for blood examinations for checking the routine examination, blood urea, NPN, creatinine, and renal function. We can check for serum calcium level and serum uric acid level. Urine analysis can be done for physical examination, chemical examination, microscopic, and bacteriological examination. Renal function test can be done. In the radiological investigation, we can go for X-ray, KUV region, ultrasonography, intravenous pyelography, computerized tomography, renal scan, and examination of the stone. There are various conditions which can resemble nephrolithiasis. So these will be discussed in DD, differential diagnosis. So these conditions include acute appendicitis, Cholelithiasis or cholecystitis, twisted ovarian tumor, testicular torsion, renal carcinomas, pancreatitis, ectopic pregnancy, aortic aneurysm, and acute intestinal obstruction. Now, how to manage a case of nephrolithiasis? Management depends on the clinical history and metabolic workup. So we have to first of all check for the clinical history and the metabolic workup. We have to increase the fluid intake of the patient at least 2.5 to 3 liters per day. The conservative recommendation for calcium oxalate stones has to be done with low salt, low fat, and moderate protein diet. Specific treatment depends on the type of the stone and it is managed accordingly. Extracorporeal shock wave lithotripsy can be done for breaking the larger stones into smaller ones. Endoscopy and open surgery is usually done. Now, what are the various complications? Complications of nephrolithiasis can be multiple. It may include impaction and obstruction at the pelvic ureteric junction, PUJ, infections which include pyelonephritis, cystitis. There can be stricture of the ureter. There can be malignant change due to the chronic irritation of the renal pelvis, anuria from obstruction. There can be hydronephrosis, pyonephrosis, renal failure, and squamous cell carcinoma. So the complications include impacted on obstruction of the stone at the level of pelvic ureteric junction, infection which includes pyelonephritis, cystitis, stricture of the ureter, malignant changes due to the chronic irritation of the renal pelvis, anuria from obstruction, hydronephrosis, pyonephrosis, renal failure, and squamous cell carcinoma. In the homeopathic management, many medicines can be given depending upon the symptom similarity. The name of some of the medicines are given, which includes acid nitric benzoic acid, Barbaris vulgaris, Cantharis, Hydrangeum, lithium carb, Lycopodium, Tabacum, Sarsaparilla, Ocimum can, Pediara brava, etc. So it's your homework to go through the book and to see this topic and also to complete the indication of these medicines that I have just given. I have also given one homework, one question for you in the notes, that is define nephrolithiasis and write the different type of stones, give their classification, clinical features, investigation, and management from your book. I've just told you each and everything in this particular lecture. I've also given the e-notes in the portal, but you have to go through it through the book and then you have to prepare your notes according to yourself. So this was all for today. In the next lecture, we are going to start with a new topic. So this was all for today. This session is powered by digital version 2.0 JAYOTI VIDYAPEETH University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve them. So this was all for today. Thank you very much. Have a good day.